Hi, everyone. Good afternoon. My name is Amity, and welcome to our webinar about data management, Ombudsman Program Data Management to Ensure Quality. This webinar is part of some work we're doing regarding helping y'all prepare for your first reporting in the new OAPS system, the Older Americans Act Performance System. And we have a guide that we sent out earlier today with this webinar reminder. There's a link, there will be a link to that shortly in the chat box if we haven't put it there already. So glad to have you here with us today. Our speakers today, we have several, which I'm very excited about. Of course, we have Louise Ryan, Ombudsman Program Specialist from the Administration on Aging, Administration for Community Living. We have Maria Green, NORC Consultant, that's been doing a lot of the heavy lifting for this work, so thank you, Maria. We have two folks from Nevada, from Jennifer Williams-Woods and Robin Tejeda. And we have Cheryl Hinnon and Aisha Elmquist, Deputy State Ombudsman from Minnesota, here today to share their experiences with data management. Today's discussion will include some specific tips, examples, and ideas to help you with your data management plan. So if you have that link to the data management guide available while participating in today's call, that would be great. If you don't, that is also okay. You can listen, and the recording will be available later. Next slide, please. Our agenda for today's call, we'll hear from Louise here just in a few minutes after some housekeeping. We will have a discussion about developing a data management plan, resources that you can use for data review, and again, you'll hear from Nevada and Minnesota about how they review and manage their data. We'll have some time for questions of all speakers and discussion, and of course, a couple slides with just reminders of available resources. The slides and recording from today's conversation will be available on the State Ombudsman side of the website with all the materials that are mentioned today. Next slide, please. Just a refresher, you should be relatively familiar with Zoom by now. You can submit questions using either the chat box or the Q&A feature on your screen. You will all be muted during the webinar today, but feel free to write a question that you have as it comes to you anytime in the chat box or Q&A box, so that way you don't forget. And we will respond to those after all the presentations are done. If we don't get to all the questions, then we'll do our best. We will have a log of those questions, and we'll do our best to follow up after the webinar. Next slide. Okay, so now it's time for Louise Ryan, Ombudsman Program Specialist from the Administration for Community Living, to share a few words about data management.
Thank you, Amity, and good afternoon, everyone. So I'm really pleased that we were able to find some resources to do this extra training and technical assistance, in particular for state ombudsman programs. Today you'll learn about basically how to create a data management plan. And for those of you who already have a system in place and a routine of how you check data and make sure it's all good, you know, wonderful, congratulations. And I hope, though, that if you have that system in place, that you'll get some new ideas and tips as we're migrating towards the Older Americans Act Performance System for your annual report to AOA, ACL. For those of you who don't have a plan, this is your opportunity to get busy in the middle of everything else. When you need a distraction from COVID-19, this could be your distraction to, you know, really pay attention to your data and to, you know, really focus on what you're going to learn about today. Is your data, is it accurate, consistent, complete, and timely? And those are some goals that we want to stress that you work on. so that not only can you have a successful report to the Administration for Community Living, but also to help you to manage your program and to identify complaint trends. I sometimes feel like a broken record here, but I'm going to continue to be a broken record and say that the data entry that not only your program representatives, but also your own activities as state ombudsman, that it gets entered into your computer software system on a regular basis, whether regular is daily or weekly or monthly, whatever it is, but frequent. So don't go too far out beyond monthly, I'd say, but that it's frequent and it's regular. And because, we are migrating to a new reporting system, and it's very dependent on that you have your data in your system. And even this year, in our last year of the Ombudsman reporting tool, I've seen state ombudsman programs that, didn't, that they had bifurcated systems. Well, some local programs were using one set of software and another was using another, or they didn't have a statewide data collection system for whatever reason, or the state ombudsman never had their data and activities entered into the system. So all of those things are like big problems that have got to be corrected for you to successfully submit your report to ACL. But again, for you to really have a handle on what's going on with your program and how to improve on it, how to find areas, trends, and just that general program management. And when I talk about data entry, I mean everybody, including your volunteer representatives of the office. They might, likely will not directly access your software program, but that you have a system for them to submit their data and that their data gets entered into your system. So that's, another critical part of this. With COVID-19, we have a new layer in terms of that you just got for some of you, a big bunch of money. For everybody, a pretty good amount of money that came through today. And with that new money comes requirements to report. There will be expectations to know not only how was it spent, but what did you do with that money. So we want you to be very consistent with your NORS reporting. We don't expect there will be new data to collect or report on, but that we want to use the NORS for this purpose. So stay tuned. There may be more specifics about that in the near future. This is also, as we're all working virtually now. If by chance you don't have a laptop, don't have a way to tap into your data software remotely away from your office, then you really need to get a laptop so that you can do that. Again, we're more virtual, we're working from home, and so you have to have all the resources at your fingertips at your computer. One more question that's kind of come up. This is more specifics around one of the data items in the revised NORS report, that one about statewide coordination activities. It's like the last thing in Table 3, where when the state ombudsman reports, they will enter from the menu from the list what types of entities they coordinate with and what types of entities their local ombudsman coordinate with. And it's really just a checklist. So in terms of the federal reporting of it, it's what do you know your local programs are doing around coordination, and that's very much connected to systems advocacy work, and that you would just select those entities that they coordinate with. So of course you have to have a way to know that. We'll kind of get a little more into that later, but I just want to say it's not something to overthink, and but you do need to know what your local programs are doing, and you'll probably want to figure out a systematic way to get that information. So just wanted to mention that because I've heard there's some questions about that. So moving forward, please use the tips and the resources that you learned today to do what Maria is going to share about to plan, to do, to check, and to act on your, with regards to your data and its consistency, its timeliness, its accuracy, and there's one more that I'm forgetting, and that it's timely. So accurate, consistent, complete, and timely. So Maria is going to walk you through some really helpful strategies that are, you know, based on work that's been done over the years on data management, and I think you'll find it really helpful. And with that, I'm going to turn it back over to Amity to get us going.
Thank you, Louise. Next slide, please. So as Louise mentioned a little bit already, as we discussed developing a data management plan today, we encourage you to plan your work and work your plan. So next, I'm going to turn the webinar over to Maria Green, NORC consultant. Maria is trained and experienced in the Baldridge Performance Excellence Program of Continuous Quality Improvement, and that training will inform a lot of what she shares with you today. So next slide, and then pass it over to Maria. Thank you, Maria.
Thank you, Amity and Louise. It's my pleasure to join you all this afternoon. Well, basically, as you know, there are at least two types of plans that you should have in your office. Some of you may in the Office of the State Long-Term Care Ombudsman Program. Some of you may have them merged, but there should at least be the State Long-Term Care Ombudsman Program policies and procedures, and then a data plan. So your data plan should align with your program's policies and procedures. And like I mentioned, it's your option if you want to merge them and have one plan with a section that pertains to data, or if you want to have two separate plans. But either way, you should review them at least annually. Hopefully you already have them in place. You should include stakeholders in the review of those plans. So stakeholders are not only your representatives, but for instance, for your data plan, if you have them, resources available to you, include your IT staff or someone from the vendor company contractor that you might have, or your data quality assurance resources that you might have. So they would be a stakeholder that would help give ideas and input about your data plan. All right, next slide. So it's really just four basic components, and these are the four that we're going to talk about today. And what I did, and hopefully to help relate to your, directly to your ombudsman work, is give an example for each one of these categories. Next slide. Okay, so during this training, we will be mentioning reports a great deal, and I just want to draw the distinction between two types of reports. So you see the map of the U.S. on this left-hand side of the screen. When I reference your state reports, that's reports that you are either able to run or create or retrieve from either your vendor, your contractor, or your state IT staff. So if today I mention a report, you like it, and you think, wow, we want to do that, then the onus is going to be on you to talk with your vendor or your contractor or your IT staff to help create that report. The other group of reports where you see a snapshot there on the right-hand side is a detailed analysis reports describing each type of report that in the near future you're going to be able to retrieve from the Older Americans Act Performance System, which the acronym is OAPS. The reports in OAPS are primarily organized by your state, your region, or the national level. And you're familiar with this. You can probably view them, by one fiscal year. You can do a comparison report of 2 years, or if you want, for some of the reports, you can go out 2 to 5 years. So it's going to be an excellent resource for you in the future to pull reports from there. Just remember this first year, all of the reports, this first reporting year, all of those reports might not be available. So most of the reports that I'm going to talk about today are going to be ones that hopefully you can pull from your system, or you might be interested in creating them in order to do so. So the next slide, we're going to address timeliness. And as a reference, we're going to look at NORS Table 1. We're going to talk about the open and closed dates for all complaints. It requires a month, day, and a year for when the case was open and when the case was closed. On the next slide, you'll see the first example. So I came up with 2 examples for this. Your policy are really just simple declaration statements. Your policy may be that cases are going to, cases open longer than 30 days must be reviewed by the supervisor. And then in your data plan, it's where you might put more of your procedures, that you're going to have the representatives enter their complaint data and other activities daily. That's a good work habit, a good practice to get into, is to enter those, that information daily. And then you may establish a monthly deadline for when the representatives should have all their data entered and any of their volunteer representatives' data entered in the software system also. So for instance, you might declare that the 10th day of each month is the date that they have to have all of their information into their into your software system. And then the people in the Office of the State Long-Term Care Ombudsman Program or regional representatives' offices, they can then look at their monthly reports and pull the ones where their cases are open more than 30 days. The next slide is going to give us a second example. It's going along the same trend, but it's that the cases are closed before or on the 90th day of the open date, unless the supervisor has given approval for it to remain open. So once again, you would have a data in your data plan that they're going to enter their activities, hopefully daily, that they're going to have them in by a given date of the month, and then you're going to create or run this report that will show you which cases have been open 90 days or more. So in the next slide, we're going to talk about what you do with that information. So let's say now you've run that report, you see how many cases are open for 30 days, you see how many cases are open for 90 days. So if you're working in the state ombudsman's office, or if you are the sole state ombudsman, either way, I would encourage you to review and look at these reports on a regular basis, because if you don't know it already, you need to establish an acceptable baseline of what is the norm for typically having a case open for a certain period of time. And then when you start reviewing them on a regular basis, you can see if you're within an appropriate range of that baseline that you've set. So nobody's saying that you can't have cases open more than 90 days. We're just saying that you need to have some markers so that the representative and their supervisor review it, address any issues, and then have a plan of action for what are the next steps, or is it legit to keep this case open. The other thing is you can look for trends. So you may identify that in a certain region of your state that the representatives have a practice of keeping their cases open all year long. For whatever reason, they decide, hey, we're gonna wait until the fall to close out all of these cases. If that's not acceptable to the state office, then you need to talk with that regional office and have a plan of correction for how to change that. So in the next slide, what we wanted to do, because a lot of your states are large enough that you have regional supervisors, or you have contracts, you have a lot of local entities where there's a contractor and there's a manager or a supervisor. And we're encouraging you, the state ombudsman, to encourage the practice that the local entity managers, regional representatives, whatever you might call them in the state, that they too are running these reports, looking them, seeing about their open and closure dates, reviewing when appropriate with representatives about plans of correction. And I'm going to take it even a step further. Even if you just have representatives out in the field, if they have access to the program and can see these monthly reports, that helps them stay on track. Or if in the state office, you want to make copies of those reports available to your representatives, I think that would be a good way to help them see and recognize not only their hard work, but the progress that they're making. It can be really rewarding to see changes and improvement. So the next slide, thank you, takes us to another component, which is about the completeness of the data. So for this example, once again, I'm using NORS Table 1. And we're looking where you enter in the type of facility setting that where the maltreatment or the complaint was filed. So it's either O1 nursing facility, O2 residential care community, or 99 other settings. Next slide. So your policy statement might be, the office and representatives shall maintain a state listing of all facility types. You need to establish a mechanism for how you're going to get that facility data. So how's it going to be obtained, maintained, and then updated? And then go a step further. The office should delineate all types of other settings that are acceptable to the program's responsibility. So if your state, you also provide home care services for the Ombudsman program or managed care Ombudsman services, that would be guidance then that you would direct staff into how to code it for other settings. Your data plan would include the note that you're going to ascertain and maintain the listings of the nursing facilities and residential care communities. And so for a lot of you, you're going to have to go to your licensure and certification agency to get a current listing, whatever it's going to take in your state to get that listing and then maintain it in your software system. Next slide. So for the completeness example, for the state ombudsman, I recommend you either review it monthly or quarterly. Depends on, after a while, let's say you start out doing it monthly, if you see that's really not an issue in your state, that the representatives are doing a really good job at defining if it's happening in a nursing home, residential care, or other, then you may not need to look at it monthly, you might can go to quarterly. Let's say that you do see a trend of where maybe they're not paying as much attention or coding correctly 99 other settings. Then the state office would do a plan of correction, maybe do a training statewide if it's needed, or maybe something simple as an email to the representatives explaining the use of the code appropriately. And then for the representatives, they can meet with their supervisors and review those reports, talk about any plan of corrections that's needed. And as always, we encourage everybody to go back and look at those NORS tables and look at the tips and examples and see that they're coding things correctly. Okay, next slide. We're going to talk about consistency. So with the revised NORS this year, in NORS Table 1, it's required that there is a code in every case dealing with a referral. So you've got the codes there, 01 through 05, that list the different entities of where you can make a referral. 06 is that you had no referral made at all, or 99 other. So let's talk about how that might look in your policy statement and your data plan on the next slide. So in order to be consistent, you would look at how the referrals are happening in your state. So If you as the state ombudsman are seeing some inconsistency in how things are being recorded or done, documented as far as referrals, this is where you're going to want to decide, what am I going to do with my data? How often am I going to do this? So in your data plan, you could have, once again, a monthly or a quarterly report to look at trends. So in your state software system, you could look potentially, I mean, if you still hopefully have access to it or have the historical information, you could look at past data and see what was the typical average of how many cases were referred to another entity. And then you can compare it to this year's documentation and see if it looks like an acceptable number or if there's something that you need to do to address the trend. Next slide. So I mentioned what the state office could do. And back again, if there are regional ombudsmen or supervisors of the representatives, it might be that you're going to want, I didn't mention this with the state office, but both the state office and for the regional level, if you want, you could do a sampling of case records. So you can only learn so much from doing a data review. It's like they call it a tabletop exercise, and you can only learn so much and pick up trends. But to really dig down and see what's going on with how referrals are being coded, I would recommend that you start looking at a sampling of case records. And it might be that you then see trends where it's just maybe one representative that needs a reminder about how to code correctly or to be retrained on it, or it could be something that is pervasive throughout the state and you would address through a training. Okay, next slide. Now we're going to talk about accuracy. This is the fourth of them. So we're looking at NORS Table 3, and we're going to talk about the data elements regarding facilities visited, residential care communities, and the number of visits residential care communities. Well, actually, I just showed you a partial listing there. If you go to the next slide. So your policy statement would read that the representatives should visit the nursing facilities and residential care communities on a regular basis to ensure resident access to the program. In this example, we're using visit the nursing facilities monthly and visit the residential care communities quarterly. So you would run on a regular basis. If you don't have it, you might need to create it, but you would run a report that would provide the data on a regular, if you want to see it from the nursing homes, you're going to see it monthly in this example. If you want to see it quarterly for the residential care communities, you would run it quarterly. Next slide. So, there's a lot of training opportunities in this. You may want to discuss and plan with the representatives how they're going to go about making sure they get their monthly visits in. I know right now with COVID, there's the concern you can't get your monthly visits in, but believe me, one day we're going to have a recovery period. We're going to be on the other side of this, and we'll get back to making our regular visits, and I know we're all looking forward to that. But they may need guidance about how to manage their time and how to get all these visits done. You would then want to look at that data and then once again address it with any concerns that there might be, and if you want to go a step further and do a sampling of case records. So this is another time I'll mention OAPs for you. And OAPs, once your state data is entered, so maybe like 2 years out from now, you're going to be able to run the comparison activity report and see the variances in your information, which will be wonderful to have. Next slide. So for those regional ombudsmen and representatives, it would be a great way to help you track whether or not you're getting visits in, to look at these monthly reports or quarterly reports. Review them to see that you got everything entered correctly. Maybe there was some information that you didn't get entered in last month that you need to get entered in. And then review accuracy of whether or not it was a routine visit or if it was in response to a complaint only. Once again, I know I have to go over and over. I've actually printed these and have them at my desk, but just go back and look at your NORS tables 1, 2, and 3 to help you with that guidance. Next slide. Okay, I'll turn it over to Amity. She's going to check and see if we've got questions.
Thank you, Maria. So we have some time right now for questions specifically about what Maria just covered in regards to the basics of a data management plan. So let me see. I don't see any questions yet, but I do want to mention, in case you didn't see the message from Louise in the chat that says, OAPS will have your past data in the system already, and it will be crosswalked to the new codes, the new NORS codes. So once you enter data into OAPS, you will be able to make some comparisons to previous years. That is wonderful. Thank you, Louise. Okay, let me check the Q&A too. Nope, okay, I don't see any open questions. We will again have time for more questions. We just thought it would be a good time to take a break before moving to the additional aspects of plan development. Okay, so I will turn it back to you, Maria. Next slide, thank you. Thanks, Katie.
Thank you. So if any of you are familiar with the Baldrige criteria for continuous quality improvement, I love this graphic on the right-hand side because it's very simple. It shows that you perform, you monitor, you improve, and that you plan. Or another way of saying it is plan, do, check, act. So you look for your alignments of your plans between your office policies and procedures and your data plan. Once those are created, look at them at least yearly and ask your representatives to participate and others as you see needed to participate and help give input into that plan. Next slide. The doing part of it is where everyone is aware through the procedures and their individual responsibilities. You've done training with them, they know what to do, they're doing their work, and they take action. So an example of that is we did a lot of training prior to October 1 of 2019 about the revised NORS. And then beginning in NORS, October, everybody started using the new codes. So that's putting into action what you've been planning and the doing part of the work. Now the next slide, we'll talk about the check. So let's say you have your plan, your data plan. You want to check in every so often to see, is this working? You want to review the work. You want to analyze the work, and you want to identify what you have learned. I believe it's going to be Jennifer and Robin from Nevada who hopefully, if they don't mention it, if y'all will mention it briefly now that I'm bringing it up, that they have a wonderful dashboard, and their dashboard are some key things that they are looking at consistently on a regular basis. That's a really good way to kind of have a, and it's called dashboard because you think of your car and you've got the gas gauge and the speedometer and everything that you kind of keep check on while you're driving. These are the things that are going to be your movers to see improvement in your program. So it's always important to do those checks. And then the next slide is to act again. If you don't take action on what you've learned, then you really haven't followed through with the entire cycle. If you learn that there's a gap in something or a training that should have taken place, then you act on that, make that training occur, or help the representatives understand what the change is, and then it just starts all over again. That's why it's continuous quality improvement. You're always doing, checking, acting, and planning. So it's pretty simple. I mean, it's pretty simple to say it and have it in that in that diagram. It's harder work to get it done. I believe on the next slide, Amity will be introducing our guests today. So I will turn it over. Thank you.
Thanks, Maria. Yes, so now we're going to hear from Nevada and Minnesota. We have a few staff members on the line, and first up is Jennifer Williams-Woods and Robin Tejeda from Nevada. And we'll make sure that your lines are unmuted. And thank you, Katie, for moving forward.
Hello, Amity. Can you hear me? This is Robin Tejeda.
Hi, Robin. I can. Thank you.
Okay. Thank you for letting us participate with you guys today. And like Maria noted for Nevada, that this is our dashboard that we use related to our caseload summary report. And a little bit about this dashboard is that we take data collected in our database in regards to open and closed cases and completed activities, which equals our caseload for each month. And we use this dashboard to compare fiscal year data from each year. And then we also use it to compare data from the month previous. And we also use it to compare data from months between fiscal years. So our management analyst completes this for us each month. And we try to look at trends. For example, percentage of ongoing cases still open from the previous month. It's the last little row on the bottom of each state fiscal year. It's the bottom row. So we look at that. We compare the data between, like I said, the months and the years. And with this, recently we were able to identify a drop in cases open between state fiscal year 18 and 19. That report's not shown because we wanted to show the most updated data that we had. And we were able to talk to individual workers and supervisors and figure out that some workers weren't being diligent, or they felt like they were going out and they were mitigating the complaint when they were at the nursing facility, and they weren't actually reporting that data in the system, which I hear from Maria is a common problem statewide. And so we were able to provide training, and so we'll continue to look through this year to see if that training helped with opening, Ombudsman actually opening, Ombudsman opening up cases for the work that they've been completing in the facilities. We use this report to identify drops and increases in cases month to month. We also capture in this report our actual workers and budgeted workers, so we can look to see if that's having an impact on the amount of cases being open and or not, or activities being completed. And we use this data to project staffing needs. Jennifer, do you have anything to add?
Just that I think I've mentioned this as we worked through our process to establish a caseload ratio. And as Robin mentioned, it is used to project staffing needs. So as we are working in our interim session for our legislative sessions that will come up in 2021, we can see where we're at in putting that in our budget overall for aging and disability services as to whether or not we will we project a need for increased staffing for this next session and next biennium. So it's really helpful for us in building our budget for the Ombudsman program. And we hadn't had that prior to our legislative session in 2015. So that was a really, 17. So that was a really great way to increase the number of staff members that we have working for our program. And I think I have the next two slides.
We do.
So we run, and just to back up a little bit to explain who we have working for us. So we have the Ombudsman program. Within the Ombudsman program, we have a management analyst who helps us greatly in running some reports and things. And then we have Robin and her other staff member, Stephanie Schneider, who's also helped present information for our program to work on the quality assurance side. So all of the entities, we all get together on a routine basis to go over these numbers. We look at our 90-day report to establish what cases have been open for longer than 90 days. So we look to determine whether or not these are opened appropriately for 90 days, whether they have supervisor approval. And we are working on getting our policy manual updated, in addition to creating a data management manual as well. So we look to, our expectation is that they have supervisor approval to have cases open for longer than 90 days. And so we want to make sure that that's documented in their case entries, so that we can go back and review that during our quality assurance reviews that the supervisors do on a monthly basis. And we use this information for training purposes. So if there is something that pops up that's out of the norm, whether it be an individual or a specific office or the entire program, then we'll go ahead and either do a training memo that we do with quality assurance, or we'll go ahead and include that in our next monthly meeting that we have with staff. Next slide. And so this was really helpful for us, the review of disposition codes. We had that gone by, or we had that run by the management analyst to determine whether or not the disposition codes were used correctly. And a few years ago, we noticed that there was an increase in the no action needed or appropriate category. And we realized that this was being used incorrectly when we went back and looked at the case examples, as Maria mentioned, because again, the data only shows one aspect. We had to go back and look. And it turned out a few of the staff members that we had misunderstood the use of this code. And so we were able to use this teachable moment and go ahead and talk with staff about when that's used appropriately. And for a little bit, we actually had the staff speak with their supervisor if they were going to use that code to ensure that they were using it correctly. And so we have since remedied the situation during that particular instance, and we continue to look at that to see if there's a need to increase our training in that area for our new staff. And those are our examples.
Thank you so much, Jennifer and Robin. Great examples. So now we will move on to Minnesota, and then we'll be able to have, like I said, more time for questions specific to these state presenters in just a moment. So I'll turn it over to Cheryl Hinnon, State Ombudsman for Minnesota.
Thank you, Amity. Oh, thank you, Amity. Good afternoon, everyone. Here in Minnesota, the skies are blue and sunny, but we're still wearing very warm jackets. So hopefully spring is right around the corner. I thank you for this opportunity to share some work from Minnesota. And we enjoyed, I always enjoy working with Marie and Amity and other folks. So again, thanks for the invitation. I want to echo something that Louise talked about, which accurate data is critical for telling the resident's story. Louise, talked about how important data is, and I certainly can verify that because data was very critical and important in obtaining a budget appropriation in Minnesota last legislative session to increase our staff. We in Minnesota have a number of staff that are responsible in state office for supporting our regional staff in terms of making sure the data is accurate, consistent, and timely. And also, we are continuing to work on how our office policies and procedures are in alignment with our data policies and procedures. So it's a living process, if you will, in Minnesota. We have been absent a management data analyst position for a number of months. And there's reasons I won't go into for that, but shortly we will have a new person starting, and I look forward to having that additional support. We appreciated all of our staff, just like yours, attended the webinars. So all the work done by Newark Consumer Voice staff area to make that happen was very much appreciated. We utilized what we learned from the webinars to develop training for our staff in order that when we move into OWAPs, our staff will understand how to accurately record reports, because it's a shift. It's a new coding system. So we did create a quiz for our staff, and it's very impressive. And that is why I asked Aisha Elmquist, who is on my staff, to review with you and talk about this very important resource that that she actually developed with some help of other staff. And before I turn it over for her, I'll just add one thing. Another investment I'm making right now is I have hired a consultant to come in and help us establish performance standards. And the performance standards within, I see an opportunity to be recognizing adherence to proper data entry, running those reports and paying attention on a regular basis to the work that's being entered into our database in a timely manner. So we are just on the beginning of working with our consultants on establishing those performance measures, but I see it as yet another aspect of how to ensure this quality, continuous quality with our data. So with that, I'll turn this over to Aisha Elmquist. And next slide.
Thank you so much, Cheryl. And just to echo what Cheryl said, I think our staff have learned so much about the value of data through seeing the way that Cheryl has communicated to staff the importance of the data, not only for reporting, but also for policy efforts that we're engaged in, which involved the budget appropriation that we received, as well as assisted living licensure that was passed last session, COVID-19 related efforts. And I think while data is not always everyone's favorite thing to do, Cheryl's leadership in showing the importance of that data and the meaning of that data on both a state and national level has made a significant difference in the improvement of data tracking in our office. So as Cheryl mentioned, we did do a quiz. We have quarterly trainings as an office. And during those trainings, we had done repeated reminders of what is a case, what are different activities, what do they mean, kind of going over the basics. But we could see from some of our data review that certain of the things weren't necessarily sticking. So we thought, what is a different way that we can approach this? And we're inspired by some of the excellent trainings that have been done on the national level by many of the folks on this call to use a quiz to provide real life examples regarding what is a case, having hypotheticals and then explanations. What is an information and assistance? What are some of these other activities? And the feedback that we received, we did not actually seek out feedback, but ended up receiving a ton of unsolicited feedback almost immediately after the training saying, thank you so much for those real life examples and going through things in a quiz format. We asked the questions in the training, then gave people an opportunity to fill out their responses and then went over the answers. And that was very, very helpful for people. This slide you see here is talking about data entry guides. And we put together 4 main guides and maybe coming up with more as well. These data entry guides are used by staff as references to ensure proper data entry. And the guides we have are first one called What is a Case? That talks about the definition of a case and how to make that determination versus when is something more of an information and assistance or other situation. The second is a description of each activity that we have in our database. And some of those are Minnesota specific that we're tracking for internal state purposes. Some are NORS reportable activities. And we go through what do those mean? What are the definitions, examples, and try to explain some of that. A third is systemic advocacy and talking about when can an ombudsman be a complainant? And then a step-by-step using screenshots guide of how to enter those systemic advocacy cases. And then finally, we have a guide on how to do some of our state reporting that for facilities, we do some work on the state level that is not reportable to NORS. So how to enter those types of cases. Specific data entries are reviewed and follow-up feedback is provided if needed. And this is especially important for newer staff, and thanks to the budget appropriation, we are getting quite a few newer staff, but it's also useful for staff who've been there for quite some time. We look at entries and might find things like an information and assistance to staff is entered as information and assistance to an individual. So we might screenshot that, put it in an email, just shoot off a reminder to the staff member to make sure to enter that under the proper activity. We may see something entered as an information and assistance that should really be a case. These types of examples we can find from spot checking the data and following up with people. And many of them are very appreciative of that because that sort of spot checking can help them to avoid errors in the future that then may be additional work if they have to go back and fix a bunch of things. They'd rather know up front to make sure that that does not occur again in the future. And then if you could go to the next slide. We have been using data and also doing even more heightened reviews of data in light of COVID-19. So during COVID-19, we are pulling daily and weekly data summaries of COVID-19 casework and other data. And we did find a way in our database to specifically isolate those cases and activities. We are getting many requests, as I'm sure most programs, if not all, are related to COVID-19 and what are we seeing from state policymakers, advocates of various types. So really pulling this daily and weekly allows Cheryl to be fully updated on what staff is seeing to be able to speak to that, as well as other people in our office. And as part of these summaries, we are providing feedback and data review. We are finding real-time errors and making sure that there are regular, timely entries of data, which is particularly important at this time. We are also doing routine access calls at this time because we can't be there to do in-person visits. And we're checking to see how those are entered, how many of those are happening, and to make sure that they are being entered as information and assistances and not visits. That is a mistake that we did see, that some folks were entering those as actually being visits. So making sure that we cleared that up and fixed any past data. And finally, you'll see this last bullet is we regularly review our database for needed improvements to increase efficiency and usefulness. We consult with regional staff and others for how can the database be more user-friendly? How can we make sure it's tracking what we need to track to make sure that we have the data that we need, not only for NORS, but also for our policy and other efforts. And working to improve our database has helped with that as well. Thank you.
Let's see, I don't hear Amity. Amity, can you check to see if you're on mute? This is Maria.
Hi, Maria. No, I was not on mute. I had to go break up something going on with my children. So
oh, well, would you like for me to continue while you go monitor?
No, I'm sure they'll be fine. This is the one day a week my husband had to go into the office. So this is COVID life. So I apologize for that.
Yes.
So time for questions. Thank you so much, Jennifer, Robin, Cheryl, Aisha. We really appreciate it. Wonderful information, very helpful for data management planning. Okay, so questions. I'm looking in the chat box. It looks like, and I'm just going to read these out loud in case y'all didn't see these. The first, this is the first I've heard of OAPS. Could someone give me a short explanation? Is this a replacement of the ORT, or is it an additional reporting system? Yes, and Louise responded, the OAPS does replace ORT. It's a good question. As a new state ombudsman, we know that this is going to be very new to you. Those that have been here a little longer have been through the process of revising NORS to get it where it is, and in the discussion for building OAPS. So we will look at having maybe even a separate call just for a new state ombudsman in the coming months to discuss OAPS. But I would encourage you, Patricia and all new state ombudsmen, if you haven't visited the state ombudsman side of the website, and I'm going to try to pull it up right now so I can share my screen, but I wasn't logged in. Or Katie, if you're there first, if you could share your screen, if you beat me to it. I was just going to go to the state ombudsman side on the new page we created with the OAPS information. Okay, thank you so much, Katie. So while she's pulling that up, on the state ombudsman side of the website, which you have a username and password, and if you're on this call and you don't know that username and password, email us and we'll get that to you. But there is a page dedicated to NORS and OAPS. And once you go to that page, thank you, Katie, we created a very brief one-page document, the OAPS highlights document right there. And that would be a really good starting point for new state ombudsmen or even those that have been here for a while that need a refresher or reminder about what OAPS is. So good question. We will get back to new state ombudsman, and Maria and I will talk about developing something specific for you all. At least we could even send an email with links to webinars and previous presentations that have been at state ombudsman conferences too, with information about OAPS. And yeah, go ahead, Louise.
Oh, sorry, Amity. I was just going to say the OAPS website itself, we'll send out that link too. It has a four-part series on how to use the OAPS, and then links to the kind of critical documents. So that's also just a good starting point, in addition to like the one pager, what you need to know. And anybody can look at the OAPS website and look at the training and all the kind of public documents. To get into the OAPS, you'll need to get a user ID and a password, which comes from ACL. And one thing I wanted to mention is that all state ombudsmen, even if you're not very hands-on with data, I'm really encourage you to have some hands-on as we make this transition You will get a user ID and a password. You have received that. Many of you have taken the steps and gone through and gotten the user ID and password, and you're good to go. Others of you have not. And then also we have new people. So if you're new or if you have not taken the steps to sign on to get into the OAPS, and it's a bit of a process, I know who is in and who's not in, and I will be reaching out to those of you who have not logged in or who are new so that you can get your entry into the OAPS. So it's really important to get that going as soon as you get the information, because it's time sensitive. The passwords and all that are temporary. So yeah, so that will be coming. You know, I got, as we all did, got distracted by COVID-19. So but I will work on getting out passwords and user IDs to those who need it so that you can get into the OAPS. And again, State Ombudsman, even if you've been hands-off with your data, this is not the time to be hands-off. This is a very important part of your program, and you're going to need to be more engaged. Most I'd say of you are, and some of you are not. And those of you who are not, this is your time. It's going to be very important, especially with the additional funding and potential requirements. So thanks, and I'll be quiet now.
Thanks, Louise. So I asked Katie, thank you, Katie, to enlarge the highlights document. As you'll see, there's a link to the OAPS page talking about how you access it and then what's available. So it mentions those training videos that Louise just talked about, as well as some really, really simple and easy to understand user guides. So thank you, Katie. And in addition to the material that's already on OAPS, just so you know, the material on that website is about how to use the OAPS system. And then NORC, we are working on creating information in OAPS ACL. It's actually an ACL Table 3 user guide, because we've been promising over time with the revised NORS that we would provide more specific technical assistance and training to state ombudsmen about all of the data elements in ACL Table 3. So there is still going to be, like I said, today's webinar is kind of a first step, that in this highlights document, and we're going to be providing additional training about ACL Table 3 and getting you all ready to enter your first report in the OAPS. So that'll be more on the programmatic side for technical assistance, and then the stuff that's currently on the OAPS website is more of the technical, how to use the actual website. So I hope that provides some additional clarification and reassurance that there'll be more training on this. So thanks, Louise. I'm looking in the question and answer box and don't see any other questions. And I don't see anything in the chat box that I've missed. Are there any other?
Maria.
Yeah, go ahead, Maria.
There was a request for Minnesota to share their quiz and data entry guides, and we will be, they did share them and agreed that we could share them with others. So I think Katie or Amity one are clicking on them now.
Yes, thank you, Katie.
Yeah.
All the materials, like I said, that were reviewed today for the webinar will be available on the website under the webinar recording right there. And sorry, Maria, go ahead.
Now, well, I just wanted to give a shout out and a thank you to both the Nevada and the Minnesota crew. I mentioned, earlier how I liked Nevada's dashboard. I want to commend Minnesota for being so flexible and stepping up and doing more to check and review cases that are COVID related, because I'm sure that many of you are getting calls from your policymakers, your legislators, your media saying what's going on in the nursing homes, what do you know, what are the cases, and to be able to have that relevant data and to be on top of it is so important. And potentially fund sources, whether it's ACL or FEMA related funds, that might come your way are going to want to know, what were the activities that representatives did that were connected to COVID. So I just want to acknowledge the work that Minnesota's already stepped up and doing in that area.
Thank you. So a question for Louise from Mark, is MedAware no longer the federal vendor?
So MedAware, also known as WellSky, because we're implementing well, let me back up. So WellSky MedAware was the vendor and is the vendor for both the the Title III side of the Older Americans Act under what we call the state program report. So WellSky developed the state reporting tool for them, and then complementary is the Ombudsman reporting tool. So the Ombudsman program is further ahead with transitioning over to the OAPs. So we're transitioning away from the ORT into the OAPs, but the rest of the Older Americans Act programs around the Title III, the nutrition and the caregiver programs, et cetera, they are still using the state reporting tool. So WellSky is still a vendor for those purposes, and I would actually, haven't quite worked this out yet, but would kind of like to have the Ombudsman reporting tool hang around for another year or so in case you want to go in and just run every kind of report you can think of using your old data if you so desire. So we haven't quite hammered that out yet. So there's still a vendor for a few more years. Everything is right now with the Older Americans Act performance system, we have one vendor who is to develop it, and then down the road it will go out again for a competitive bid in terms of the ongoing maintenance of it. So it's not just a one and done, and it never is. These things always go out for recompete. So that's probably longer of an answer than you wanted, but there you have it.
Thanks, Louise. Very helpful. Okay, Katie, if we can go back to the slide deck, please. I don't see any more questions coming in right now. Per usual, if you think of something after you leave today or it comes up in the coming weeks, months, you know where we are. So feel free to ask any questions you have. I wanted to just run through a few slides with reminders of where we have information. The NORS instructions, training, and all those materials, including frequently asked questions, including the most recent addition to those FAQs specific to our times living through COVID. They all of that information is available on the public side of the website at that first bullet. And then the second bullet links you directly to the FAQ page. As a reminder, especially for those new ombudsmen on the call, we do have the FAQs in a PDF document that you can use and share easily with your programs that they could print out or use in training. So we hope you find that helpful. And then again, on the state ombudsman side, that is where we keep all the state management and state level specific information related to NORS and OAPs, and that's again where that highlights document was. So please keep an eye on your inbox every Friday, at least during this time-sensitive COVID world. We will be sending out a News You Need email synopsis every Friday that has updates from the Resource Center, federal updates, as well as information from your peers. And we also will include information as applicable about OAPs. So please check your inbox. That's where you'll find those links to that information. Also on the State Ombudsman side of the website, there's a link that will take you to the archived emails, and we save all the emails that we send you there. So if you think you missed something or want to go back and read something, you can access that there, or you can reach us directly. Next slide, please. So today we are very, very grateful for everyone, all of our presenters. This has been a work in progress over a few months, and as you know, we had to move the webinar from March to April due to our current situation, and so we especially appreciate the time of all of our presenters today, from Louise to Maria, Jennifer and Robin of Nevada, Cheryl, Aisha of Minnesota, for sharing their examples and personal experiences with data management, as we know that time is extra valuable right now and hard to come by, so we really appreciate that. You had an opportunity to ask questions, of course, and we reviewed some resources. As I mentioned earlier, the slides and recording from today's webinar will be available on the State Ombudsman side of the website, and we will include in the Friday email that goes out later this week a link to all that information, so you'll have it there as well. Next slide. Just a reminder to contact us with any questions or comments as they arise, and then the next slide actually has our contact information on it. Feel free to reach out to myself, Louise, or Maria with any questions that you have. And next slide. With that, unless any other questions come up, I'll be able to give you a few minutes back in your day. This, of course, has our contact information as well as our social media and our app if you haven't downloaded that, or let your representatives know that we have an app available for the Resource Center. So that's all we have today. Thank you so much for everyone's time and attention, and for our presenters. We appreciate all the time and information that you shared today. It's going to be very helpful as we move forward in this new data landscape. So thank you. And I apologize for that brief interruption.
It was very smooth, and thank you, Amity, for all of your work, and the staff of the Resource Center, and Maria, and all the presenters. So thank you very much.
Thank you. Take care. Have a good day. Bye.